All right, so today I'm talking about Neuralink and especially Nolan Arbaugh, who I met last week in Las Vegas. So in 2016, Nolan was a young, active college kid. He was a freak accident at the beach. He became a C4, C5 quadriplegic, which means below his shoulders, he's completely paralyzed, can't move his arms, legs, anything below the shoulders. So after years of limited independence, caregivers needed for almost everything. Nolan was the first recipient of Elon Musk's company Neuralink's implant. So this brain-computer interface allows him to control his computer, which is like playing games, typing, browsing, with just pure thought. Not voice commands, literally just thinking about doing it does it. So that is pretty cool. The story's still sad, but today I'm going to go deep on the story and the accident, implant, how his life has changed, and then looking ahead, I think not just the next set of implants, but the future of Neuralink, especially their second big product, which is restoring sight to the blind, and everything else on the roadmap. All right, so there's also a lot online already that Nolan himself has posted or other creators have spoken to. Just wanted to go through a quick version of it here. So in January 2024, he became the first human to receive the Neuralink N1 telepathy implant. So there's basically like a small coin-shaped battery implanted in the skull, and they opened up a section of his skull, and they implanted about 1,000, what do you call them, like threads, into his brain, into the motor cortex. So the motor cortex is what controls your movements, right? So when you or I want to, pick up your water bottle and drink it, like in order to move your arm and stuff, your motor cortex, certain parts of it will light up and send the signals, and it happens. You don't like actively do it, right? It just happens automatically when you think about it. So just like that, even though he can't move, when he is like, okay, they're monitoring his brain, okay, try to pick up the bottle, and it records what parts of the motor cortex light up and things like that. So they just did that for mouse control. So he's able to control the mouse cursor with his brain now, which is super cool. Think about moving the mouse first, and it kind of got better over time. So he uses this about 10 hours a day. If you watch his other videos or talk to him like I did in Vegas last week, he uses this computer control for the web, email. He can study, he games, he plays chess, which was like a chess.com thing he did. He likes Mario Kart. He and I talked about Slay the Spire 2, a game that I'm playing right now too. Pretty fun game. He also mentioned that he returned to college. He's at community college. He wants to get into neuroscience. And yeah, he's done a lot of professional speaking. He spoke at the AI conference last week also. He's been in like a Mr. Beast video. He was on Lex Friedman's podcast. I think he's really interesting with all the things that he's able to really do and get done. He's also talked about this implant isn't forever. He's just part of a trial. In another few years, they're going to remove the implant, and he's going to go back to his life as a quadriplegic without this, which he takes with kind of a grain of salt. He understands, and he was like, I lived for about 7-8 years before this Neuralink thing, and I'll live beyond this after it too as well. So interesting take on it there. But all right, I'm going to move forward to the future of Neuralink itself. All right, so one thing that was mentioned before I get into the restoring vision to the blind is right now, Nolan, his brain's working, but his spine is kind of severed at C4, C5 in his neck, so nothing below that works. One of the ideas that's already kind of being worked on in animals is to add, instead of having this communicate with something that can control a computer, it's to have that implant communicate with the broken part below to kind of bridge the gap or jump the gap. And you'd still be able to control your body theoretically with that. I think they have basic stuff done in animal trials, like they can move their legs and stuff. But I think it needs to get a little more mature before it's ready for human testing. But it's still pretty cool. And yeah, the newer ones are going to be more electrodes. I think you go from 1,000 to 3,000 more implants, more access to brain areas. And yeah, Neuralink's goal is really restoring independence at scale. And then going further. So I don't know what further looks like. There's a lot of superhuman stuff that people are thinking about, but I think that's far beyond today's scope, kind of. Really, it's restoring function to all of these folks who have lost that function. All right, so their second product, restoring sight to the blind, It's the same kind of thin film array technology, but instead of recording like the inbound side that we have right now with what your brain is doing, and then transmitting that to do something, it's the opposite. It's stimulating. So the way that your visual system works is that these lights, these photons, they hit your eyes, then photoreceptor cells convert that into electrical signals, and that gets projected to your visual cortex and processed. So that's a simplified explanation, right? So there's a lot of different forms of blindness. I don't want to go through all of them. They have like retinal prosthetic devices and things like that. But if you have damage in that circuitry, like in the optic nerve or anywhere along the way, you need something that's going to source the outside world, like a GoPro or a camera or something. Then you convert that to electrical impulses and then activate the visual cortex in your brain using those threads that Neuralink has innovated. So yeah, basically you're just going to record the world, stimulate your visual cortex directly, and shoot it into there, and you'll be able to see even if you don't have eyes, even if any of the kind of plumbing of your visual pathways are broken. So that's really cool. I think their patent called Blindsight had breakthrough device designation in 2024. So that's people who have lost both eyes and the optic nerve, or were born blind with their visual cortex intact. They're working on that right now. So the human implant should be in the next 6 to 12 months for this. The resolution in the beginning is not going to be great. It's going to be like early video game Atari level graphics, but it'll improve over time, and who knows what, maybe they'll see new colors or some kind of thing like that. So we already have monkeys using this for a few years. But yeah, that's pretty interesting. So again, the distinction is it's writing to the brain rather than like reading, right? So if you're a computer guy, it's like a read-write, input-output kind of thing. So yeah, same core technology, but like a different application of it, and I think that's pretty cool too. Yeah, I just quickly wanted to go through the projects that Neuralink is working on. I think they're really inspiring, and being at an AI conference and hearing a lot of the companies are still, majority of companies on Earth are still working on ROI and all the regular business things. So it's nice to hear these kind of more moonshot companies. Obviously, a lot of people have positive or negative thoughts on Elon Musk, but he is using his money here, funding Neuralink in order to improve the lives of people. Whether or not he creates a zombie robot army to take over the world, yet to be seen. But I do think he's doing a lot of good in this, talking to Nolan, hearing his story. There's a really, really long podcast on Lex Friedman podcast, about eight hours or so. It has a lot of folks, even has the neurosurgeon who implanted it. He interviews them all back to back to back, including Nolan, Elon Musk. DJ is also on there too. So there's a lot of folks there who give some more insight than I'm giving here. But yeah, I just wanted to kind of update people, because I think I take it for granted that everyone's heard about this stuff. And yeah, it is really cool. I'm really excited about it. And yeah, hopefully you go and look more into Nolan's story and get more excited about Neuralink. And if you know someone who might benefit from any of these, I'm going to add the patient registry in the link. So all right, thanks for watching.